This is the Emergency Medical Minute.
I'm going to talk to you a little bit about asymptomatic bacteriuria in elderly women. Frequently we'll see patients who come into the emergency department and they'll come from nursing homes or sometimes from their homes a little bit confused, a little bit altered, and we'll look for sources of that, whether it's metabolic or sometimes infectious. So a common source is urinary tract infections. The conundrum comes when we find elderly women with bacteria in their urine, but not sure if they're really infected, because about 20% of elderly women in the community have asymptomatic bacteria. Means no burning, no frequency, no hesitancy, no hematuria. But when you do a urinalysis, you find bacteria. About 50% of institutionalized women have it, and 100% of people have indwelling catheters. So the question is, when is that really a urinary tract infection, and when is it contributing to their perhaps malaise or altered mental status? We use lots of different things. We look at a urine, we look at did the nitrates turn to nitrites because the bacteria have an enzyme that causes that. The white blood cells in the urine have an enzyme called leukocyte esterase, so we'll look at that sometimes in the urinalysis. But technically, a true UTI to be diagnosed has to have what's called 10 to the 5th colony-forming units for high-powered field on culture. And you have to have it 2 sequential urinalyses, which we never do in the emergency department, and we never see the cultures. We never see those in time. So we have to use that information that we get from the urinalysis site. Is this really a urinary tract infection? One of the newer tests that's come about in the last couple of years and being used especially inpatient, you'll see some people order it here, is what's called procalcitonin. Procalcitonin is a precursor to a hormone peptide that's involved in calcium homeostasis. And it has a pretty quick turnaround, so we can do it from the emergency department. Studies show excellent correlation between rapid rise and elevated levels in infections, including sepsis. So there's a good study called ProACT done a year or two ago, published about a year ago, that looked at procalcitonin levels in lower respiratory tract infections. Good study. The idea was to help it reduce unnecessary antibiotic use and kind of promote our antibiotic stewardship. But the problem with it is that not a lot of practitioners really believed that. They did not want to let a pneumonia go untreated. So we may be able to use it, and again, it's just another piece of information to make you think in urinary tract infections in elderly women. If you have someone who has bacteriuria, and you can't tell if it's asymptomatic or not in some of these women because they're altered mental status, either because of their infection or baseline. But sending a procalcitonin level that is elevated may also give you additional information as to whether or not to treat and whether or not to look for other sources for altered mental status in that population.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.